Hello, I'm Greg Jamian, and welcome to Boomer Health at Home. As more baby boomers receive medical services at home, there are many questions that pop up that require sometimes quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hello and welcome to another edition of Boomer Health at Home. I'm your host, Ryan Donnellan. On today's show, we're going to discuss pertussis and steps that you can take to make sure yourself and your loved ones are protected. Here to offer an expert opinion and some medical advice on this topic is the Assistant Director of Nursing for Ameristaff, Janet Alderman. Janet, thanks for joining us today.
Hi, how are you?
Great, thank you. So I think the question on everyone's mind is, what is pertussis?
Well, really what most people hear about it is whooping cough. And the reason it was given that name is that when you cough, you make this, you're gasping for air, so it makes a very distinctive noise for people that have whooping cough.
Wow, okay. Now, if someone were to contract this, who is most vulnerable or who's at the most risk?
Infants, children, or anyone that's immune system is compromised. And the reason because it is, and what it happens is that you get mucus in the bottom of your lungs, and it's hard to get that mucus out, and they can go into respiratory distress and actually even pass away from it.
Wow. Now for us, if we were to contract it, how long does it typically last?
The symptoms can last 10 days, but the cough itself, that can last 100 days. It's a long process, and that's why it can be so severe.
Okay, now the number one question is, how can that be prevented?
Vaccination. And actually there's a rise in the whooping cough epidemic right now because people are not getting vaccinated, and then they have also found that the vaccine is like running out. Like maybe I was vaccinated when I was a child for whooping cough, but as I go into adulthood, the vaccine is wearing off.
Is there a booster shot or something available?
Definitely should be getting a booster. The booster should be given to anyone over the age of 19, and it also should be given about every 10 years, they're finding out.
Okay, you'd mentioned now if a toddler or something caught it, they're at risk. If a woman is pregnant and contracts it, is the baby at risk as well?
Most definitely. And that's why people that are pregnant should even talk to their doctor, but they should get a vaccine because they then in turn will build up the immunities when they're pregnant, and then they'll pass them on through childbirth to the infant, and then it will protect them also once the baby's born.
Now, if you do get the vaccination, are you fully protected after that? Or is it?
Well, they're saying that you're protected for 10 years, so they're saying that you should always get a booster after that point. You can be a carrier of it, so it's really important that you do get that vaccine. You might not have the symptoms, is what I'm saying, but you can have maybe the disease, so you don't want to pass it on to people.
So you could have no symptoms but still be contagious to pass on the pertussis.
Yeah, and that's the big thing right now, that you'll see some campaigns on TV about it, as far as grandparents taking care of infants. They're passing it on to their babies without even knowing it because they don't have symptoms, and so they're passing that on to their grandkids without even knowing it.
Wow, so if you do have it, how is it treated?
Usually antibiotics will treat it, and then hydration, keeping those that mucus thin so you can cough that stuff up is another big thing. So you really want to make sure that you get that treatment as soon as possible if you think you have the symptoms.
Great, and now you said that it is on the rise. Do you know approximately how many cases we see for the?
I'm not sure. I think I'm not really sure. I know that it is more prevalent nowadays.
Okay.
There is a rise in it.
Right, and especially, I mean, any rise in something that can also lead to death is something to be of concern. So that's great information. I think it's all the time we have for today. I appreciate you coming on and giving us some more information. If someone does suspect they have it, is the best course of action to go see the doctor immediately? Or?
Oh, most likely, yes, most definitely is to, if they're having a cough, that specific cough, it's a dry cough, if they have a fever, if the cough is lasting more than 10 days, that might be some of the symptoms that they need to seek medical treatment.
Great, well, you heard, if you do have those symptoms, we recommend you go see a doctor right away. But in the meantime, if you have any questions about pertussis or would like to speak with Janet directly, please call us at 248-288-2270. Janet, thanks for joining us, and thank you for watching at home. Have a great day.